Thank you, Chairman. Thank you, everybody. I'm Ryan Chen from Taipei, Taiwan. It's my honor to be here to introduce our work of the one-year follow-up study on assessing the range of segment motion and clinical outcome following cervical disc arthroplasty for treatment of severe cervical disc degeneration. First of all, this is a young adult with a normal alignment. Not this one, sorry. Okay, this one. This is a young adult with a normal alignment and disc high, normal disc high, and patency of the ankle vertebral joint, no facet was seen. And later, maybe in the late 40s, maybe 50s, then the spine may develop like this, especially in C5, 6, degeneration develop with this high decrease of facet hypertrophy and spur formations. Degeneration of the cervical disc is a nature and inevitable occurrence associated with the aging process. It cannot be stopped because of reduced water content of the disc and diminished disc height and the formation of osteophyte. So what happened if it developed and still processing? According to this journal, it seems that the range of motion decreased as the disc degenerate, especially in the flexion and extension. And extension show the significant difference from the moderate and severe degenerative disease. So according to another journal, range of motion decreased from every 10 years to about 5 degrees as aging process and 1.2 degrees decrease for every degenerative grade increase. That means that the more degenerative, the facility of the spine decrease. So as a result, the disc pressure will decrease as the severity develop. But what happened? The disc pressure decrease, that means the shearing force will transfer to the facet loading. So especially in the extension and compression, the severities develop associated with the facet load increase. That means maybe in the late 50s, 60s, or 40s, even 40s, our spine or neck pain develop because of the disc degenerate and the facet load increase. So maybe later on it will develop like this. The severe degenerative spine will show, and with the complication of cord compression, maybe nerve compression, etc. So what happens? So that means preserving and restoring range of motion and disc height are very important because of this aging process. So according to the previous author, they mentioned about the severe or high disease is a relative contraindication for cervical disc arthroplasty. But we look at the advantage of cervical disc arthroplasty. It preserves the motion of the cervical level and reconstruct cervical spinal alignment, reduce the degeneration of the adjacent segment. That means arthroplasty is very, very useful, especially for the degenerative disc. So is this really relative or contraindication to the severe disc degenerate? So our study will focus on this purpose. So far, no study has been taken to assess the result of the cervical disc arthroplasty for severe cervical degenerative disease patient. So we want to investigating the impact of CDA in severe cervical disc degeneration patient in terms of range motion preserving and the clinical outcome changes. So from 2017 to 2019, the patient was included with arthroplasty, excluding the criteria on the left-hand side. So, and then totally, we only involved the single level from C3 to C7 level. Finally, 40 patients are included, and female predominant. patient characteristics are here. There's 14 numbers, average age about 58 ages, and female predominates, and C5, 6 level predominate above 25 patients. So the radiographic and clinical outcome assessment, we measure the range of motion by flexion and extension of the treat level by the posterior tangents or methods. And for the clinical outcome assessment, the neck disability index and the VAS score for the neck and the arm. Here the result of the radiographic outcome, it seems that the mean pre-op range of motion is about 6.57 degrees. After 3 months, the range of motion increased from 6.57 to 11 to about 11, and then it maintains this preservation after 1 year. The gain of the range of motion mainly result from the increasement of the extension, but not from the flexion, according to our results from measure the extension and the flexion respectively. After 3 months, the flexion or the extension contribute the most increase angles. How about the clinical outcomes? The clinical outcome, whatever from the VAS of the neck and the arm. For the neck, that means maybe because we preserve and restore the range of the motion, that means the facet load may decrease. So after post-op, there's a significant decrease for the neck pain from 7.5 to 1.5. And for the arm VAS, that means this is for the radiculopathy from the pre-op 6.6 to decrease to 1.6. And the total daily life improved, and which is proved by the NDI score. So here's the example for the pre-op and the post-op from the extension view and the flexion angle. Both are increased after the operation. So what's the trick of this this degenerative arthroplasty? So maybe we concerned about the unconvertible joint recessions. According to this paper's recession, whatever or by partial or complete or bilateral, it all shows improvement of the range of motion from the interspine and from the disc replacement without recessions. That means unconvertible joint recession is also crucial from this severe degenerative disc replacement. So this is a result for this corner view. We can see there's a level of the disc replacement, and the bilateral unconvertible joint recession was seen clearly. In conclusion, CDA is an effective surgical treatment that can improve clinical outcomes and restore range of motion in severe cervical disc degenerative patients. And the post-operative extension range of motion may be responsible for the increasement of post-operative range of motion. And it is safe according to this 1 year's follow-up. Thank you.